Welcome to the Dale and Frances Hughes Cancer Center. Our mission is to provide the most technologically advanced cancer treatment in order to offer every patient the optimal chance for cure. We provide a full line of cancer treatment services to our patients. Patients of the Hughes Cancer Center can be assured that they will receive the best possible treatments delivered with the latest technology surrounded by a caring, compassionate staff. All of our physicians are board certified and specially trained in their fields of oncology expertise. Attention will be given to the medical, emotional, financial, nutritional, and psychological needs of each patient and their family. Medical Oncology. Advances in medical oncology. Cancer care is changing rapidly, with new and more effective combinations of chemotherapy, fewer and better treated side effects, hormone therapies, biologic and targeted therapies. What are biologic and targeted therapies? Biologic and targeted therapies are drugs that block the growth of cancer cells by interfering with specific molecules involved in tumor growth. They can be given by intravenous injection or pill form. They are more selective for specific cancer cells, thus often fewer side effects. They are sometimes given in combination with traditional chemotherapy or radiation. What is chemotherapy? Chemotherapy is the use of drugs to stop or slow the growth of cancer cells. Cancer cells reproduce in a series of steps called the cell cycle. Chemotherapy is timed to hit the cancer cells at specific points of their cell cycle. What does chemotherapy do? Chemotherapy eliminates cancer cells within the body. It increases survival rates by controlling cancer. Chemotherapy eases cancer symptoms. How is chemotherapy used? Chemotherapy is used as a sole treatment to destroy or control cancer cells. It is used to shrink tumor sizes before radiation treatments or surgery. Chemotherapy is used in combination with other treatments to increase therapy effectiveness, and it eliminates residual cancer cells that remain or have spread to other parts of the body. How is chemotherapy given? Chemotherapy is given intravenously through a vein, with injections or taken orally with pills. Chemotherapy is always given with kindness. How is chemotherapy chosen? Your doctor will refer to scientifically based guidelines developed by the National Comprehensive Cancer Network. Other considerations include patient's personal needs and preferences, the cancer type and extent of growth, responses to prior treatments, the goal of treatment, cure, control, or symptom management. Can I skip a dose of chemotherapy? The closer you adhere to your chemotherapy schedule, the more successful the results. If needed, your doctor may change the schedule due to side effects. Occasionally, the timing of your treatment may be able to be adjusted to allow you to participate in a major life event. Remember, treatment on time is best. How can I prepare for my chemo treatments? Stay hydrated. Eat a light breakfast the morning of your treatment. Avoid greasy, spicy, or citrus foods. Take prescribed pre-medications as directed by your nurse or doctor. Bring a current list of your current medications and dosages to each appointment and treatment. Write down any questions you may have. Bring along a family member or close friend to your first treatment. Plan for someone to drive you home from your first few treatments until you see how you will respond. Why does chemotherapy cause side effects? Chemotherapy eliminates or damages rapidly dividing cells. In addition to cancer cells, some healthy cells also divide rapidly, including hair follicles and cells in your skin, blood, mouth, throat, stomach, and intestines. Side effects from the first treatment do not necessarily predict reactions to future treatments. Every patient is unique and responds differently to chemotherapy. What are the most common side effects? Fatigue, nausea, hair loss, appetite changes, changes in bowel habits, low blood counts, or anemia. Our goal is to minimize your side effects during treatment. What causes fatigue? There are many factors that can contribute to fatigue, including chemotherapy, other medications, low blood counts or anemia, emotional distress, physical pain, the cancer itself. What can I do about fatigue? Do activities that are most important first. Ask others for help. Maintain a healthy diet. Drink at least 8 cups of water a day. Try to exercise at least 15 minutes every day. Take power naps during the day. Balance rest with activity. Will I have nausea and vomiting? Nausea is much better controlled than it used to be. Your doctor, nurse, and dietitian will give you tips on how to control nausea. Nausea can occur depending on the treatment being received. Medication will be given during treatment to prevent nausea. In addition, a prescription may be given to take home. Why am I at a higher risk of infection during treatment? White blood cells, WBC, are a type of cell that helps your body fight infections. Low WBC counts, neutropenia, can result from chemotherapy and biologic agents. This will make it harder for your body to resist and fight off infections. What can I do to prevent infections during treatment? Prevention is the key. Maintain good hygiene. Wash your hands well and frequently using soap and water or antibacterial gel. Have others around you wash their hands too. Stay away from people who are sick or have a cold. Try to avoid big crowds. Call your doctor or nurse if you have any sign of infection. Signs of infection include fever of 101 or greater, chills, cough, sore throat, ear pain, stiff or sore neck, swelling or redness anywhere, bloody or cloudy urine, pain or burning when you urinate. Will I lose my hair? Not all chemotherapy causes hair loss. The degree and timing of hair loss depends on the specific chemotherapy, dose, or other treatments received. What can I do if I lose my hair? Protect your head from the sun if hair loss occurs. Use sunscreen, a hat, scarf, or a wig. The cost of wigs are sometimes covered by health insurance. It may help to attend a support group and talk to others who have had similar experiences. Hair loss can be emotional, but remember that it is temporary. Hair will grow back. What about intimacy? Usually, it's acceptable to have sex while undergoing chemotherapy, but be sure to talk to your doctor or nurse about special precautions to take. Both men and women should use some form of birth control during chemotherapy treatment. Some drugs can cause birth defects. Chemotherapy can, but doesn't always affect fertility. Speak to your doctor before you start treatment if you plan on having children in the future. What if I have appetite changes? You may notice you are feeling less hungry or that foods taste different. Mouth and throat changes could cause trouble eating or swallowing. Good oral care is important. Avoid mouthwash or rinses that contain alcohol. Supplements like Boost, Ensure, or Carnation Instant Breakfast are good for days when you don't feel like eating. Your nurse and dietitian will provide tips to make eating easier. Eat well to help your body stay strong. What can I do about constipation? Drink lots of fluids. Eat high-fiber foods, bran, whole grain bread or cereals, fresh or dried fruits. Talk to your doctor or nurse about over-the-counter medications. What can I do about diarrhea? Your doctor or nurse will instruct you on over-the-counter medications you may take or foods that may help. In addition, it is best to eat 5 or 6 small meals a day instead of 3 big meals. Drink 8 to 12 cups of liquids. Clear broth, Jell-O, lemon ices are good until diarrhea stops. Avoid dairy products. Reasons to call your doctor's office immediately. Fever greater than 101 or any sign of infection, which includes chills. Diarrhea more than 5 times per day. vomiting that doesn't respond to anti-nausea medicine, blood in urine or stool, unexplained bruising or prolonged bleeding, unusual symptoms that began after chemotherapy. What other services does medical oncology provide? Management and treatment of other non-cancer blood disorders, hematology, iron infusions, IVIG infusions, IV or intravenous hydrations, administrations of blood products, red blood cells, platelets, fresh frozen plasma, therapeutic phlebotomy, maintenance of indwelling intravenous catheters. Radiation oncology. What is radiation therapy? Radiation therapy is one of the most common forms of cancer treatment. Radiation therapy uses a stream of high-energy particles such as X-rays, electrons, or photons to destroy or damage the cancer cells. How does radiation therapy work? All cells, cancerous and healthy, grow and divide. Radiation therapy affects only the tumor and the surrounding area. Once cancer cells receive radiation, they are unable to grow or reproduce. Who is involved in your radiation treatments? During your radiation treatments, a team of medical professionals will care for you, including radiation oncologist, doctors specially trained to treat cancer patients with radiation, medical physicist, ensures the radiation equipment is working properly, dosimetrist, designs the treatment plan in correlation with the radiation oncologist, radiation therapist, positions you for your treatment and operates the radiation equipment, radiation therapy nurse, provides you with information about radiation treatment and side effects. Other supporting staff include dietitians, physical therapists, social workers, speech pathologists, and nurse navigators. How does your doctor plan your treatment? Choosing the type of radiation depends on the type of cancer you have and how deeply the radiation needs to penetrate the body. After a physical examination and a review of your medical history and test results, your doctor will design a plan of treatment. You should discuss with your doctor the potential benefits and side effects associated with your type of treatment. What is a simulation? The simulation process is where your treatment planning will begin. During the simulation, special placement devices are custom-made to aid in your daily treatments. The treatment area will be marked permanently with a tattoo the size of a freckle. What is external radiation? External radiation requires a machine called a linear accelerator. Linear accelerators direct high-energy rays to the cancer site. Treatments are given as an outpatient service but can continue if a patient is admitted to the hospital. Will the external radiation therapy make me radioactive? External beam radiation will not make a patient physically radioactive. When the beam turns off, the radiation stops. Patients can resume normal activities after daily radiation therapy treatment with no restrictions. Patients are able to be around family members of all ages after treatment. What are three-dimensional or 3D conformal radiation treatments? 3D conformal treatments are a technique where the beams of radiation used in treatment are shaped to match the tumor. 3D images of your body are used to create your treatment plan. This type of treatment controls the amount of radiation the surrounding healthy tissues receive. What is intensity modulated radiation therapy, or IMRT? IMRT allows very precise external beam radiotherapy treatments. Benefits of IMRT include reduction or elimination of the extra radiation that would hit outside of the treatment site, retreat cancers which have previously been treated, treat multiple tumors at the same time. What is stereotactic body radiation therapy, or SBRT? SBRT treatment gives a very high dose of radiation to a very small area of the body. SBRT is used for early-stage small tumors. Treatments are typically completed in 1 to 5 days. What is brachytherapy? Brachytherapy is internal radiation that uses a radioactive source in the form of a pellet. The implant or pellet is placed directly into or near a tumor. Implants may be permanent or temporary. Will brachytherapy make me radioactive? Low levels of radiation can be emitted for a period of time. Your radiation oncologist or nurse will advise you if any precautions with family members are necessary. How long does the treatment take? Radiation therapy is given Monday through Friday, usually every day. Treatment regimens typically take 1 to 8 weeks to complete. Sessions can last 15 to 20 minutes due to the time required to set up equipment and position the patient correctly. The actual treatment takes only a few minutes. Are radiation therapy treatments painful? A radiation treatment is just like having an X-ray. You cannot see, feel, or taste a radiation treatment. Radiation therapy only affects the area of the body being treated. Preventing and managing radiation side effects. The most common side effect patients experience is fatigue. Your doctor or nurse will give you advice for caring for yourself that is specific to your treatment. Will I lose my hair from radiation? Radiation only affects the area of the body being treated. Radiation treatments to the brain or scalp may result in temporary hair loss. Will I become sterile? Some treatments for specific cancer locations may cause sterility or issues with intimacy in patients. Your treatments will be planned in such a way to avoid these issues. Other options are available for protecting or saving your reproductive options. Please speak with your provider if you have concerns regarding this. What can I do to take care of myself during therapy? Get plenty of rest. Eat a balanced and nutritious diet. Protect the treatment area from the sun. Be gentle to the skin on the treatment area. Avoid wearing tight clothes. Do not rub, scrub, or use adhesive tape. Do not apply heat or cold to the treated area. Do not use a pre-shave, aftershave lotion, or hair removal products on the treatment area. What about daily routine or activity? Some patients find that they need more rest than usual and cannot remain as active. Most patients are able to work and maintain their daily routines during radiation therapy. Support services. Cancer survivorship. Cancer survivorship is the process of living with, through, and beyond cancer. It starts upon diagnosis and continues after the completion of treatment. Personalized survivorship care plans are created for each patient. The nurse practitioner will review this plan with the patient at the end of treatment. What is a survivorship care plan? A survivorship care plan includes the following: a personalized treatment summary including listing of patient care team, relevant pathology results, surgical history, medical therapy treatments including chemo, hormone, and biotherapy, radiation therapy treatments, schedule for follow-up care and continued visits with your oncology providers, information on possible late and long-term side effects and signs of recurrence, available supportive care resources, recommendations for healthy living. Clinical trials. Clinical trials are studies that test and evaluate new methods to diagnose, treat, and prevent cancer. Many cancer patients participate in clinical trials because they offer new alternatives to standard treatments. The Hughes Cancer Center is affiliated with the esteemed Jefferson Cancer Network, offering access to many clinical trials that would otherwise be unavailable. For more information about the clinical trials available at the Hughes Cancer Center, contact our Oncology Clinical Research Coordinator. Nurse navigation. Our nurse navigators are specially trained to help patients and their loved ones navigate the healthcare system. No-cost patient services include expediting patient appointments, testing, and results, providing single point of contact for questions and concerns, anticipating and addressing obstacles efficiently, coordinating with providers for timely diagnosis and treatment, connecting patients with resources, screenings, support, and education. Complementary alternative medicine. Volunteers offer patients physical, mental, and spiritual healing aid through the following programs: massage, Reiki, pet therapy, art therapy, music therapy, guided imagery. Oncology nutrition therapy. Good nutrition is important to maintain before, during, and after cancer care. A registered dietitian is available to support patients during the course of treatment. For more information about nutrition services, please contact the clinical dietitians at the Hughes Cancer Center. Speech-language pathology therapy. Some types of cancer can affect a patient's ability to speak or swallow. Speech therapy can be beneficial for these cancers during treatment. A speech therapist will provide advanced diagnostic and therapeutic interventions for reduced mouth opening or trismus, difficulty swallowing or dysphagia, oral motor and speech or voice dysfunctions, trouble with words or thinking, aphasia and cognition. Social and supportive services. Social workers are available to help patients who are experiencing need for emotional support or financial and transportation assistance. There are several support groups available for patients, family members, or caregivers dealing with the cancer diagnosis. For more information on where you can get help in dealing with your diagnosis, speak with your nurse or social worker at the Hughes Cancer Center. Cancer awareness events and celebrations. Many events take place throughout the year to raise awareness of cancer and to celebrate life. If you are interested in attending any of these events, please visit PoconoMedicalCenter.org. You will be provided with compassionate treatment and hope to give you the care you need most. Let us focus on your diagnostics, your treatment, and your medical care. You focus on healing.